The Ebola virus actually creates what they call a cytokine storm, which is what actually causes the hemorrhage and the bleeding and ultimately the death in people who do die of it. The fact is that high doses of vitamin C and antioxidants can actually thwart that process, and particularly intravenously. I wish they were doing high-dose IV vitamin C on Ebola patients right now intravenously. But that being said, the important fact to remember is that even the flu, which is, we're now getting into flu season, many of the different strains of flu act very similarly to Ebola. The Spanish flu back in the early 1900s actually had this very similar metabolic picture in that it created a hemorrhage all over the body, massive hemorrhage, including in the lungs. And so the answer is to essentially gird yourself, build up your immune system, eat healthy, exercise, but there are a number of supplements which our practice carries and which we publish various protocols on that can help keep your immune system in tip-top shape and provide you with the antioxidants that can help buffer this cytokine storm, and essentially, and I believe help save lives in the case that someone does get a bad case of the flu, especially people who are younger or the elderly or in some of the other higher risk groups. So that's really the take-home point, is that there are a number of things that can and should be done: high-dose vitamin D, vitamin C, intravenous infusions of some of these things, such as our immune augmentation and glutathione, high-dose vitamin C intravenously, that can help boost the immune system, detoxify the body, and prepare you for travel in particular, because travel is a very risky thing these days on the airlines, or for just any time during cold and flu season. We encourage folks to come in before they travel or before they get the flu, be educated about what are the top of the line standard of care for immune boosting and helping keep their bodies in the best shape possible.